Okay, liposuction. Liposuction, it's been around since 1976. There was a French OB-GYN that actually invented it, and it was kind of a revolutionary idea at that point, that rather than having to go in and take out skin and fat, we could just go in and remove some of the fat and just assume or predict that the skin would contract around it. And it's not designed for doing the entire body. We tend to do localized areas where we all tend to have more fat. And I think it's important to realize that the fat cells are permanently removed. So for instance, let's say you've got a saddlebag, where it kind of juts out here. I tell patients, imagine you've got like 25 fat cells there, whereas further down the leg, maybe you have 10 or 15. What we want to do with liposuction is take the 25 and move it down to 10 or 15. That way, not unlike a grain elevator filling up hopper cars, it's going to get bigger proportionate with the rest of your leg. And so unless you gain more than 80 pounds, you will not form more fat cells. Okay, liposuction, men and women have genetically determined fat deposits, and the number of fat cells remains constant after puberty unless you gain more than 50 pounds. Men tend to have excess fat, love handles, lower abdomen, oftentimes in the breast area. Women, oftentimes lower abdomen, flanks, and the saddlebags, and oftentimes in the medial thighs. Here you see what we call kind of a saddlebag. She probably has 20, 25 fat cells here, maybe 10 or 15. What we want to do is we want to restore that hourglass figure. You can see here, in this pictorial representation, also has kind of bulges out there, and that corresponds to more fat cells. Okay, two types of liposuction, invasive versus non-invasive. In terms of invasive liposuction, basically we bring you to the OR and we'll either sedate you or put you all the way to sleep, and we will inject what we call is a tumescent solution, which is lidocaine with epinephrine. It numbs up the area and it decreases bleeding. And then we'll go in with a cannula and actually aspirate. I can go in, you've got a fat deposit, and I can literally remove it, and we're pinching the skin afterwards. A lot of people think this, oh my gosh, you got this, the cannula in there and it's so brutal. Fat cells have very little in the way of innervation, and there will be some bruising from the cannula hitting the underlying muscles, but most people are able to return to work and normal activities 2 to 3 days after liposuction. And we use compression garments for a month or so to try and get that skin to retract maximally. A couple of liposuction examples. You can just see here. Go. And here, lower abdomen. You can kind of see the overall contour improvement. And we do this a lot in men, kind of the moobs as we call them. This gentleman was a professional photographer, and basically just didn't feel good going over to Africa and just having kind of these breasts. And so we went ahead and did liposuction here, and this was him afterwards. And go ahead and there still is going to be some fat there, but this was a pretty dramatic difference, and especially for guys that want to wear a polo shirt or play golf, we tend to do that a lot. These are kind of our patient group that we see that want the liposuction of the chest. Here's a woman, lower abdomen, and here's a man. Actually, we did kind of the love handles here. You can see there versus there. Here, we got a tattoo there, so it's the same person. But yeah, that's pretty dramatic. We can go in an hour and turn you from that into that, which I think is pretty amazing.